So today is October 7th, 2021, which marks exactly 27 years I've been on medication. So I made a video about this, and I did talk about how the first person whom I saw was a gastroenterologist who put me on something called a tricyclic antidepressant, which is something that you never put somebody who's still growing on, because I ended up staying 5'3". I never grew past that, but all the same, this video is kind of about just psychiatry in general. Just the general thing about psychiatry is it's such a guessing game. Psychiatry is empirical. You just observe the person and you have to guess. I have had many misdiagnoses in my life. I was wrongly diagnosed with bipolar for 10 years. It's not my doctor's fault. There was one doctor whom I saw a year after I saw this gastroenterologist who put me on bipolar medications, thinking that I was bipolar. So I was really highly medicated. I was very low functioning. He put me on something called valproic acid, but he put me on a lot of it. He did put me on clonazepam, which I'm currently on today, which is benzodiazepine. Put me on some other mood stabilizers, and it never really fixed the underlying issues that were behind how I was feeling. It really just zombified me, and so it seemed like I was stable, but it zombified me, and a lot of my autism spectrum, a lot of my autism showed. I definitely was not normal. I had no friends, and I can look back on that and laugh. But it's just, the fact is, I don't blame him, because it is very difficult, especially at that time when I was 11 years old. I wasn't much of a talker. I didn't communicate my feelings. I was actually terrified of doctors, and I was terrified of myself, even. I was terrified of everything. So I don't even blame that doctor. But moving up, when I was 16, I had my first psychosis. I have made a video on that. It was kind of strange, and I do actually plan to talk a bit more about that, because I'm seeing YouTubers like Elliot McGavin talk a little bit more in depth about their psychoses, and I think a lot of people are interested in that kind of thing. But all the same, he did diagnose me with schizoaffective disorder and potential schizophrenia, so he put me on olanzapine, which caused a massive weight gain. And that medication worked, but unfortunately I had a lot of side effects. I had tardive dyskinesia, which is a Parkinsonian symptom. I had torticollis. My neck would go to the side. My trochlear muscle in the eye, it made my eyes all buggy. I always look as though I had a look of surprise on my face. Eventually thought, this person's doesn't have schizophrenia. I think they're just bipolar. So they took me off that medication. Whether I know I definitely did have hallucinations and delusions, but I kind of kept them quiet. I didn't bother talking about them. And then when I was 20, when I had my second major psychosis, which was so bad that I actually fell into my stress levels were so bad, because that I actually fell into a coma and ended up with nephrogenic diabetes insipidus. I've talked about that too. If you want me to talk about it more, I can talk about it again. I can talk about how falling into a coma and near dying actually did, and how even being pronounced dead had actually caused that. I can talk about that if you want me to. But all the same, I completely forgive him for what he did, because when I was 20, that's when I started seeing a different psychiatrist who said, "You're definitely not bipolar. I can tell you that. You definitely have severe depression, severe anxiety, and I think you have Asperger's." But she later dismissed the Asperger's, saying that I was kind of just maybe not really trained. My parents obviously thought I had some sort of behavioral problem, but it's the case that I was never really around people. I was kind of stuck home all the time. I never had a job. I didn't have a job till I was 20, a few months after that hospital stay, and that's when I started seeing how other people acted, and things got better. But I absolutely forgive my psychiatrist for any shortcomings that may have happened, any kind of misunderstandings. Nowadays, most psychiatrists, they try to push pills on people, and I don't think that's the right way. What I'm on is perfect. I'm not over-medicated. I have to be on medications. Unfortunately, it is $475 every 3 months, but I have to be on that. And, all in all, psychiatrists are not therapists. It's not their job. So it is just empirical observation. So if they keep you in the hospital for a longer period of time, just to observe you, they're doing that just really to get the right diagnosis. Anyway, as always, thanks for watching.